So acne can present in a number of different ways. It can be papules, it can be pimples, it can be cysts, it can be nodules. It can be distressing, that's for sure. But the goal is when you're treating acne in people of color, they typically are more likely to develop post-inflammatory hyperpigmentation, which are brown spots on the skin. And this can be as distressing or even more distressing than the acne itself.
Dyspigmentation is when you have acne, you have red bumps, red spots from your acne, the acne heals, but then you have some pigment that's left over. You have a brown spot, a dark brown spot on your face, a circular spot that's there.
The best way to avoid PIH, or post-inflammatory hyperpigmentation, is to try not to pick. And I know I'm a picker myself, but you really want to avoid picking because picking leads to hyperpigmentation and scarring, and it just makes it that much more difficult to treat.
If individuals have a serious acne problem, they need to see a dermatologist and see us quickly. Because if you get in, we can initiate therapy. There's topical therapy and there's oral and systemic therapies that work. But you need to get early care, because if you let your acne fester for a long time, you're gonna have a lot of dyspigmentation, you're gonna have scarring.
One thing that's easy that everyone can do is wearing your sunscreen. Sunscreen can help to prevent worsening of your pigmentation, particularly tinted sunscreens that block visible light.
Acne has a lot of itch, it's very itchy. Just try to distract yourself because you don't want to squeeze it, you don't want to touch it, because then you may have a scar. So it's really important not to manipulate your acne if you can try your best, but I know it's tough. If you can't do that, try to squeeze something, try to distract your mind, try to put a topical on there. Sometimes we put some of our over-the-counter acne medicines on there. There's some other acne medicines that you can put on now, bandages you can put on to have a little medicine on there. The nerves are a little bit irritated because the secret is that acne actually has microbial colonization with things like Staph aureus, which is bacteria, and we know that actually Staph aureus triggers itch. There's recent findings showing that a protease in Staph aureus triggers itch. So they're gonna be really itchy because of the bacterial colonization. So you can put on an antibacterial on your acne, a topical antibacterial, which a dermatologist can give you a prescription for, something like clindamycin or a combination agent, and that can help a lot. I actually view acne as a very, very important condition to treat immediately because of the permanent sequelae. I have some patients who just had their acne fester for many years. They had the dyspigmentation, but worse, they had the scars. And the scars are there on their face forever, for the whole world to see. It's not just acne, it's what acne leaves behind sometimes. I would want individuals, patients to feel the urgency. If your acne's not controlled, get therapy, see a doc. You know, we can treat you. We have topical agents, we have new topical agents coming out, we have oral agents that are really good. We just need to see you so we can initiate that early.
So there are a variety of ways of treating acne, particularly in skin of color. You're treating acne in a PIH. So it's important to consider both topical medications, some of those are over-the-counter, some of those are prescriptions. Sometimes we use oral antibiotics. Sometimes we use procedures such as microneedling, lasers, chemical peels. The options really are endless, so it's really important that you find the right treatment choice with your doctor, because some options may be helpful and some options may have certain side effects. And you want to make sure that you're taking the right course of action.